Good afternoon. Thank you for joining me for this virtual news conference. Today, I'm going to provide a brief update on Jacksonville's COVID-19 response and our partnership with Duval County Public Schools. Joining me today is City Councilwoman Brenda Priestly-Jackson, Duval County Public Schools Superintendent Dr. Diana Greene, and Emergency Operations Center Director Steve Woodard. Before we get started, I want to offer my congratulations to all candidates in yesterday's election, to those who won and to those who courageously put themselves forward for the betterment of our community. As someone who has been on a few ballots and been involved with a few campaigns, I know how stressful elections can be, not just for those in the hot seat, but for their families and their teams. Despite all the challenges this year has brought us, it lifts my spirit to see the resiliency of our democracy. I hope you all remain engaged in efforts toward building a stronger, more vibrant, one city, one Jacksonville. I look forward to working with those who won in the years ahead and those who win the general election in November. Turning our attention to COVID-19, according to the latest data from the Florida Department of Health, there are 130 new cases of COVID-19 in Duval County, 232 deaths, and an overall cumulative positive testing percentage of 11.23%. However, the daily percent positive tests in Duval County have dropped to 4.2%. My team and I continue to have regular contact with our area hospitals. They are reporting 292 COVID-related hospitalizations in Duval County, and all report available capacity. Administrators tell me they are encouraged by the latest data. Speaking of that, our numbers are continuing to trend in the right direction, which is good news. I want to thank everyone watching today for doing their part, but we cannot be complacent. Even though the numbers seem to have plateaued and to be declining, we must continue to practice preventative measures and exercise personal responsibility. As long as this virus is with us, without a vaccine, the possibility of community spread remains and is likely. So let's all do our part. Wear your mask, maintain a safe social distance from others, avoid large crowds, and frequently sanitize your hands and other surfaces. These simple steps remain our greatest tools in combating this virus. As parents throughout the area are aware, tomorrow is the first day of school for Duval County. As a parent, I understand the anxiety and stress many families are facing as kids head back to the classroom amidst this pandemic. In fact, my children head back to public school tomorrow alongside many of yours. That's a choice that we made as a family. For those of you whose children will be attending virtual classes, I've said all along that options are important, and the community is. I'm grateful to Dr. Diana Greene and her staff for their hard work to make these options available. My team and I have been working closely with Dr. Greene and the entire Duval County Public School team to make our schools safer for students, teachers, and staff. We have a $1.5 million project to offer free COVID testing for Duval County Public School teachers and staff throughout the school year. The city is contributing $750,000 with the Duval County Public Schools committing $750,000. I want to thank Dr. Greene and her team and City Councilwoman Brenda Priestly-Jackson, who called me with this idea many weeks ago, asking if we could partner and work together to make sure we could create this environment and option for our teachers and their teams. To speak more on this, I'll turn the meeting over to Councilwoman Priestly-Jackson to say a few words, followed by Duval County Public Schools Superintendent Dr. Greene. Councilwoman Brenda Priestly-Jackson.
Thank you, Mayor Curry. Thank you so much for your openness and willingness to hear the needs of diverse aspects of our community. I want to thank Dr. Greene, Superintendent of Schools, my colleagues on the Duval County School Board and City Council for understanding together we must address the needs of our community during this crucial time. In particular, I want to thank Dr. Greene and the Duval County School Board for creating options, viable options for parents to choose in-person or distance learning. Like many of you, Duval County Public Schools and teachers are vital and important. My father was a teacher and my husband is a teacher now, who will return to the classroom tomorrow. I am encouraged by the timely response that's going to be developed for teachers to get testing throughout the year should there be a need as we resume instruction. I believe if we can keep this continued focus of serving our neighbors together, we will continue to grow as a city, and we will all address the needs of this pandemic timely and combat it in Jacksonville. Again, thank you, Mayor Curry, so much for your openness, and Dr. Greene.
And thank you, Councilwoman Priestly-Jackson, for your leadership on this and for putting this together, bringing both sides together on this. Dr. Greene?
Thank you, Mayor Curry. I want to thank you and Councilwoman Ms. Priestly-Jackson and our Duval County School Board for working together to ensure that we do everything to support our teachers, our employees, and our students. This opportunity to put $1.5 million into rapid testing and additional nurses in our schools is a priority and paramount for us to fight this COVID-19. For our schools, this means that we will have 25 additional nurses. Some of those nurses will be dedicated to rapid testing that we will have 7 locations at 7 high schools in our district for each board member district. Teachers, if they meet the criteria with symptoms, they immediately will be directed to a location. That nurse will give them the test, and we will have the results back within 24 hours. That will allow us to be able to make decisions, be able to support that teacher in the classroom or that employee as quickly as possible. This is also very important to us, and I don't think the mayor or Councilwoman Priestly-Jackson knows this. The portion from the city we will share with our charter schools, because these are all of our students, and we need to ensure all employees that are working in our public schools have access to testing and that they can get their results quickly. So we will give proportionate share to our charter schools of the city's $750,000. Again, thank you so much to Mayor Curry, and thank you to Councilwoman Ms. Priestly-Jackson, and to my school board for really standing behind this and ensuring that we can be one of the more progressive school districts in supporting our employees.
Thank you, Dr. Greene, and thank you for your work and efforts, the school boards. I want to thank you for your decisiveness, your leadership in this time. I can tell you that with all the uncertainty we face, I'm comfortable that my kids are heading back into our public schools in a safe environment where they'll be cared for, nurtured, and be able to get back to learning. Before we close and go on to questions, on Monday night, the SEC announced its college football schedules that included a strong Jacksonville tradition. The Georgia-Florida game has been a key part of our community since 1933. I'm proud to see this tradition continue in 2020. And for those of you that's, whether you say it Georgia-Florida or Florida-Georgia, people always have a comment. It changes every year. One team's the home team. This year will be the Georgia-Florida game. I'm sure that this game will probably look and feel different on November 7th, but it speaks to the great resilience of our city and its people to continue this game in a safe and a fun way. With that, thank you for joining me and for getting this important information out to Jacksonville. Emergency Operations Center Director Steve Woodard, Dr. Greene, and Councilwoman Priestly-Jackson are all on the call with me this afternoon to answer any questions. Joe with News for Jax.
Yes, hello, good morning. Yeah, I'm Joe McLean with WJXT. I had a question for the superintendent. We're hearing a lot of questions and concerns from families about not having their bus stop assignment, not getting calls returned, not having teacher assignments yet. I'm wondering how, if these delays are normal, or if this is just natural pre-school year working stuff out. What can you say to these families who say they're not getting answers. I guess the phones are flooded over there.
Yes, this is normal for the start of school. Anytime you're opening a district that serves over 130,000 students, and this is the first time we're asking parents to register for their bus stop. And to date, we've registered over 28,000 families. Normally, we serve about 48,000 families through transportation. And with the addition of Duval Homeroom, that pretty much has been cut in half. And so I encourage parents to, one, go on the website and look at the information that tells you how to register. Two, we will have a location at the Schultz Center starting tomorrow for families. If you still need information and you can't get anyone on the line, you can come to the Schultz Center, and we will have representatives representing many different areas to support families. Email works really well. If they want to email their school or email the transportation department, many families have gotten answers very quickly. But yes, our phone lines are very busy, and it is quite normal at this time of the year.
Lorena with Action News.
Good morning, everyone. I have some questions for Dr. Greene and also for you, Mayor. I'll start with Dr. Greene. Dr. Greene, child immunizations are down this year according to the CDC. What are you telling parents about that, and are you concerned about that lower number of kids getting immunizations this year because of the pandemic? And also, some parents are telling us that they're getting last-minute information about uniforms. What can you tell us about that, and you know, how many schools have changed their policy with uniforms? And Mayor, we're seeing clusters of COVID at other college campuses across the country. Have you been in touch with the local colleges and universities about their safety plans? And also about the shipyards, if I could, what is your plan if a contract with Iguana is never signed?
Well, I'll go ahead and start with immunizations. We are working on a campaign with the Department of Health in ensuring that parents know that they need to get their immunizations. They have 30 days within the beginning of the school year when they enter school, and our school nurses will be reviewing all of the blue, we call them the blue cards, they're the shot record cards, and notifying those parents that if their card is not up to date, and the timeline that they have to get their immunizations up to date. As it relates to uniforms, that is a school-based decision, and each school makes that decision. And so I encourage parents to reach out to their school principal. I would start with email to get answers as it relates to uniforms.
Yeah, as it relates to your two questions, first of all, look, the universities are going to have to make their decisions based on what they think the best interest of their students are. And we're certainly here to collaborate and help. We have been in communication throughout the pandemic, but I would just suggest that community spread is real while it's here. It is likely to happen while it's with us, whether it's at a university, whether it's at a school, whether it's people that have gone back to work in recent months. And we know how to operate and deal with this. And that is, we've got to learn to live with this in a responsible way. So if there's a positive case or cases, you identify, you trace contacts, you quarantine and isolate and test for a period of time. And that's what I would expect to happen. As it relates to Iguana Investments, the news yesterday was no surprise. In fact, we are in regular meetings with them. We had a meeting with them. My team did, at least recently, as maybe a week and a half ago. This is a timing issue. Iguana Investments remains 100% committed to developing that area. And so I don't have, they're not walking away from the deal. They're going to follow the process and make downtown Jacksonville a better place. Jim with News for Jax.
Hi, my question really is for Dr. Greene and on this new testing program for teachers and staff. It just sounds, you want, if a teacher is sick or a staff member, they go to a high school to be tested on a rapid test. Is that safe? And, you know, there was some concerns about that, I know, from the union. And then what happens to that classroom that the teacher was in. I mean, have you ironed out all of those details of what's going to happen and during the meantime until you're waiting for those results?
Well, it is a drive-through, so the teacher never gets out of their car. They don't enter into the facility. It is a drive-through. They just go to that. They call, the principal calls ahead of time. That nurse knows to be there, and they drive through, and the test is taken, and then they are to go home. It would be no different if a teacher came in the middle of the day and said, I'm not feeling well. We would send them home and get a substitute and work through that. And that's why we are so committed to the rapid testing, so that we don't have to wait. If the results come back negative, then we have steps for the teacher to take. If they come back positive, we have steps that we will implement through the Department of Health, which we're sharing with our board today, that we will enter into contact tracing and make those decisions about who has to quarantine from that, the results of that test.
Thank you. And let me just add, as we're going back to school, you know, months ago we went back to work. A zero risk policy would be everything shut down, everybody stay home. It's simply not sustainable. The food chain supply would break. The economy would collapse. Mental health, other health issues would continue to get worse. Elective surgeries would be put off, which often then lead to more serious issues. So as we go back to school, our superintendent and our school board have put procedures and precautions in place to do it in as safe way as possible and to mitigate risk. But risk and community spread is real. I've said it before, I'm going to say it again. We have to learn to live with this while we don't have a vaccine. And if you are at higher risk, or someone in your family is at higher risk, you should act and behave accordingly. Hence the options our superintendent and our school board has given students and teachers going into this school year. AG with Florida Politics.
Hey, Mayor, good morning. Thanks for taking my question. When we look at the schools, you know, we have uneven physical structures, as you know, a lot of poverty, the oldest school buildings in the state, et cetera. Are students endangered by the HVAC systems in these schools? Sort of a corollary question. You know, do you regret the sales tax referendum not going through last year, now that there's, you know, a demonstrated need probably to retrofit a lot of these buildings? You know, you made a lot of decisions, obviously, the landing demolition and the Hart Bridge. Do you wish you put resources into the schools earlier?
I couldn't hear the first part of the question. Let me see if anyone on my team, it was kind of muddled and scratchy. James, did you hear the first part of the question? AG, what was the first part about school facilities before you asked about resources?
Do you wish you had done the tax in retrospect earlier? Do you wish there had been a 2019 referendum, given that, you know, schools are going to be retrofitted for the HVAC needs of going forward with COVID?
Always make the best decisions with the best information I have at the time. I'm grateful to where we are and look forward to working with Dr. Greene and getting this half penny for our schools passed this year. And by the way, if it had been on the ballot last year, you still wouldn't have access. Construction and work wouldn't be done at this point. The timeless just wouldn't work. So we're going to get it done. We're going to work collaboratively together. And again, I've got kids going back to public school tomorrow, and I'm grateful for the leadership and precautions that have been put in place by Dr. Greene and the school board. And I am looking forward to a year of learning with my children. Hannah with WOKV.
Hi, Mayor. This question primarily goes to Dr. Greene. And this is primarily for middle and high school teachers, but I've been told that they are being assigned to Duval homeroom classes at the same time they are teaching in-person classes. So how is that supposed to work for those teachers? And I'm also hearing that teachers are having to buy extra PPE supplies as they are only being given one bottle of hand sanitizer to last throughout the year. Is there more PPE supposed to be coming throughout the year? And what would you say to teachers who are having to go out and buy those supplies when it's not really available?
Well, first, no, teachers are not teaching Duval homeroom and teaching a class at the same time. They may be teaching some brick and mortar classes and some Duval homeroom classes. So that is correct, but they're not doing it at the same time. If first period is brick and mortar, then they're teaching students who are there in the building, and second period might be Duval homeroom. So now they're teaching students who are learning remotely. As it relates to PPE, we have outfitted all of our schools with the necessary hand sanitizer, gloves, facial coverings, face shields, and yes, we have put it out in stages. When we will replenish, we have a monthly sort of timeline that we go back in and replenish schools as they need. So teachers do not need to go out and purchase additional PPE unless, according, you have a favorite type face covering you want to wear versus the ones we provide you, then that is their choice.
Emily?
Hi, thank you. About this rapid testing project, will the funding also apply to student testing access? And then additionally, we've seen prioritization at some public testing sites across the state for certain age groups or people with showing certain symptoms. Would a school or student priority zone be something considered for Jacksonville testing sites? Thank you.
Were those questions for Dr. Greene?
Regarding the project, I figure that could be for either of you. I guess they both could apply to either of you. So
Sure. What was the, I'm sorry, what was the second part of the question?
yeah, so the first is about if rapid testing, if the project will also apply to students. And then the second is if there will be consideration for a priority zone maybe for student testing or students with symptoms or school people, whether that's faculty, students, etc. To be tested maybe at the federal sites.
I'll let Dr. Greene answer here in a moment, but before, and maybe Councilwoman Brenda Priestly-Jackson, again, who I'm grateful for bringing this partnership to me in my office. We've got a tremendous start here to rapid testing for teachers and staff that I think is really important. And as we navigate this, the situation is fluid with this pandemic. I'm always open to ideas and partnerships, particularly with our schools, that will continue to create safe environments. Dr. Greene?
Currently, the project is for employees only. It's for any employee, whether they are a teacher, a paraprofessional, any our district level employees. We have worked with the city with other testing sites, especially for our students. And I hope that we can continue that partnership and allowing students and their families to have access to the other federal testing sites.
Yeah, let me add that there is tremendous access to testing in the city right now. And the test result turnaround times, particularly on the city-sponsored ones, sometimes there are delays, but that's not usual. It's usually, last time I looked, about 3 days. There's also pediatric clinics in town that are testing children, and those things turn around same day. So there's a lot of options, a lot of availability, and I encourage people if they need a test, they think they need to get tested, there's plenty of options available, including options for our young folks.
Mayor Curry, I think the other thing to add is this is an enhancement for the teachers. So we're not minimizing or taking out any of the services that the city and the federal government's already providing for testing access. So this is something specifically targeted for teachers and staff who are our most precious resources in terms of disseminating knowledge for our young people and kind of on the front lines of this.
That's exactly right. Thank you. Last question, Alex with First Coast News.
Thank you, Mr. Mayor. I saw Dr. Greene needs to jump off the call, so I'll direct this first question to her. But for code red drills during the pandemic, do you feel that those can be safely done after the Department of Education Commissioner said in his July letter that rejecting the request by DCPS to pause these drills? And for Mr. Mayor, you mentioned Florida, Georgia coming back and how exciting that can be. Any concern bringing teams into town, bringing additional fans, things like that this far out?
As it relates to your first question about the drills, even though we did get an answer of no from the commissioner to not have the drills, further guidance has come down on how we can do those drills in a safe manner where we're not having to have students all collect in a corner. So we will implement those changes. Our Director Edwards, the Chief of Police, is training our principals actually, I think today, on the number of drills that are required to be had. So they did reduce the number of drills in the first month from 2 to 1, and that we can do more of a role-playing type method instead of all of the students having to move to different locations for an active shooter drill, or all of the students having to go outside for a fire drill. So there will be changes.
Yeah, first I would say the Southeastern Conference, the SEC football specifically, they have the precautions in place. I mean, it's going to be a safe environment for their staff, for the ball players, for their teams. So I don't have really any concern there. They're getting these guys back on the field in a safe, smart, responsible way. As it relates to fans and community spread, we don't know at this point in time what capacity will look like, what events may or may not look like. It's just too far out. So as we've done throughout this entire pandemic, we will monitor the situation as we get closer. And that game will be played in a way that mitigates spread and mitigates risk and is healthy for our community, but allows us to continue to experience the tradition that is the Georgia-Florida game. Thank you.